So today we're going to talk about depression. So I know most of you guys were complaining that Mujib, we don't want to talk about mental health conditions. So we are going to talk about some mental health on our weekends. So if you want to follow, I will be releasing some videos about mental health condition. So today we're going to talk about depression. So depression is a serious mental health condition that affects millions of people worldwide. Yeah. And depression is characterized by persistent feeling of sadness and loss of interest, which can significantly impact a person's thoughts, feelings, behavior, and physical health. Yeah? So don't misunderstand depression with occasional feelings of sadness. Yeah? So which is normal. It's normal to feel some bit of sadness in life. Yeah. So but depression involves a combination of symptoms that interfere with daily life and can last for weeks, yeah, or even months. Yeah. So where does depression come from? So depression is a complex condition with an unknown cause, but is believed to result from a combination of very many factors. Yeah. So we're going to categorize them into 5 different factors. So we are going to first talk about the genetics. So if you have a family history of depression, yeah, so this one can risk you to getting depression. So we are going to also talk about the brain chemistry. So if you have imbalances in neurotransmitters such as serotonin and dopamine, yeah, so this one can also play a role in you getting depression. Yeah. So we are going to also talk about life events. So if you have a stressful or a traumatic experience, yeah, such as loss or abuse or financial difficulties, so this one can also trigger depression. So we are going to also talk about medical conditions. So if you have medical illnesses or hormonal changes, so that one can also contribute to you getting depression. Yeah. So we are going to also talk about personal traits. So some personality traits such as low self-esteem or negativity, so that one can also increase your vulnerability to getting depression. Yeah. So what are the signs that you might be having depression or your friend might be having depression? So we are going to categorize them. Yeah. So we are going to start with the emotional symptoms. So under emotional symptoms, you can talk about persistent sadness, hopelessness, irritability, and anxiety. Yeah? So we are also going to talk about behavioral symptoms. So we can talk about loss of interest in activities, social withdrawal, fatigue, changes in appetite or sleep patterns. Yeah? So we are also going to talk about cognitive symptoms. So if you're having difficulty in concentrating, feeling worthlessness, guilt, thoughts of death or suicide, yeah? So that one can be among those cognitive symptoms. So we are talking about the physical symptoms. So these ones include unexplained aches, pains, digestive problems, and also decreased energy levels. So depression is a treatable condition and seeking professional help is crucial for recovery. Yeah? So there is treatment for depression, and this treatment can include psychotherapy. So you can go to those psychiatric clinics or you can go to psychiatrists so that they can give you some treatment. So we can also talk about medication like antidepressants. So you go to experts such that they prescribe for you very well and get that treatment very well. So you can also talk about lifestyle changes. So you can go for regular exercises. Yeah, you can run, you can jog. We can also talk about eating a balanced diet and also getting sufficient sleep. Yeah? That one also helps. So you can also talk about stress management techniques. So you know those stress management techniques like the deep breathing exercises. So that one can also help you. So thank you very much. I remain Mujib.